My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to D.O or Do Not. If you're interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
My name is Violet Sullivan, and I am a pre-osteopathic medical student who will be attending the University of New England in the fall, and you are listening to D.O or Do Not. In today's episode, we explore the question, what does a brilliant, empathetic osteopathic family practice physician do in retirement? Lay on a beach, play Scrabble, pickleball? Maybe, but our guest today has a lot more in mind. Today we will interview Dr. Joel Fetter, a retired family practice and osteopathic physician. Dr. Fetter, a graduate of Kansas City University College of Osteopathic Medicine, will start by telling us about a recent medical mission he went on in Vietnam. He will describe his current volunteer experience working in street medicine with limited resources to serve a homeless population. Dr. Fetter will go on to describe his journey, including his family medicine training at the Naval Hospital in Philadelphia, before serving active duty in San Diego. He will share his passion for his time in the Navy Reserves for 38 years and his pride in being an 06 captain rank. Dr. Fetter will tell us about his experience in family practice for 40 years, where he had an intergenerational reach as a community leader in Kansas. Ultimately, I found Dr. Fetter's passion and pride for being an osteopathic physician is infectious and inspiring. I know you will enjoy this episode as much as we did.
All right, Joel, thank you so much for being with us tonight.
Thank you for having me.
Joel, I want to start by saying that I love when we get recommendations from other guests. So Stella Rabina loves you and says you're the best mentor ever and couldn't stop talking about how we needed to connect with you.
That's very sweet of her. Probably not all true, but I thank her for that compliment.
Yeah, she had nothing but sterling things to say. So now, just to start, you have retired from a family practice. Is that correct?
That is correct. I retired in 2019, right before the pandemic began.
Okay, but you can't get away from medicine, it sounds like. So can you tell us what you're doing now? Tell us medically what you're doing now.
Sure. I wanted to get back into clinical medicine a bit. So I joined as a medical provider at an organization here in Kansas City called Care Beyond the Boulevard. And basically, we take care of homeless folks. We do that in fixed clinics, as well as we actually get on a bus and go on the street and take care of folks. It's quite a change from when I practiced in suburban Kansas for middle class and upper middle class folks. This is quite a change. And I've really learned about practicing medicine without the resources that you really need. In other words, I use my five senses. I use my stethoscope. We can do some lab work. We do have prescriptions to hand out. We do a lot of wound care in the winter. And these folks have the normal chronic problems that all our patients are plagued with. And I'm talking about high blood pressure, high cholesterol, diabetes, uncontrolled. These folks have their medicines stolen from them on a regular basis. They live in horrible situations, but I've really found it inspiring. We've got students from the school in Kansas City that come with us, and they assist me when I find something interesting. I always bring them in on that. And we have some fixed clinics at some of the churches in the hood, so to speak. The street medicine, myself and a fourth-year student who just matched in emergency medicine are going to give a couple of presentations to local organizations about the practice of street medicine because it's a very unique specialty.
Very cool.
That's the only clinical medicine I'm doing. I am teaching at Kansas City University. I teach first and second year students. Physical diagnosis skills. We do mannequin-based experiences. We do simulated patients, that sort of thing. And I love teaching. It's just great. These kids to me are so young and so eager and so smart that I just love to do it.
Joe, one of the reasons that Stella told us to connect with you is because she's so passionate about family practice, and you've been involved with the ACOFP, which is
College of Osteopathic Family Physicians.
Tell us what that organization does, why it's important, and how you've been involved over the years.
I've been involved with the ACOFP once I got out of the Navy and I had more time. And I'll talk about my Navy experience quite a bit because it's very important in my career path. The ACOFP is the D.O counterpart to the AAFP, the MD Association. And in fact, we just started taking MDs as members, and we have some, not a lot, but some. We're an organization. Actually, that's how I met Dr. Rubina, was through ACOFP at one of the meetings. We do 2 big CME meetings a year. We have one coming up in about 2 weeks in New Orleans. And then we go to OMED, which is the American Osteopathic Association annual meeting. I'm also vice chair of the committee that puts that one together. And I was conference chair of the ACOFP. So I've been very active, spent a lot of time putting these meetings together. And that's really my passion, is putting CME events together. We've got a multitude of young physicians who speak to our organization. We also bring in consultants, MD and DO, to talk to us as well. And we have committees that handle that. And I've been very active and hope to be very active for a long, long time.
It's amazing. And the guests that we've had on the podcast, sort of the theme of our podcast and what we want to teach is that DOs can do anything, but really the philosophy and the training lends itself super well, maybe best, to family practice. Would you agree with that?
Absolutely. OM&M, osteopathic manipulative therapy, is a key part to family medicine. I used a lot of it when I was in practice as another modality that my MD counterparts couldn't do. And I think it helped to grow my practice, because once patients came to me and I could do that for them and make them feel better, they came back to me for their routine medical care. And that is exactly how you grow a practice. And I'm very proud of being a DO. I kind of started out as a DO who wanted to associate with MDs. And after about 15 years of doing that and having some discrimination against me for being a DO, and in those days there was plenty to go around, I decided, I'm a DO, that's what my degree is, and I want to practice as a DO. I've never been ashamed of that. I have always put Joel Limfetter, DO, on my office. I don't put Dr. Joel Limfetter, so people don't know what I am. I know all the tricks. Mm-hmm. And I've been very happy practicing as a DO. I was in practice for about a little over 40 years. And so the thing I love about family medicine is it's a generational specialty. You take care of grandkids, kids, grandma and grandpa, and I even had a few great-grandchildren. And you see them for all their needs. You know what's going on in their families. How many other specialists, not to attack you in gastroenterology, but have that kind of reach to a family on an individual basis? I am still friends with some of my patients. We still go out to breakfast together. We go to basketball games together. That never stops. The fact that I'm retired just puts me in a different sector, not so much in private practice.
There is no question, and I certainly don't take it as an insult in any way, shape, or form, that I have a small group of people that if you said, who's your doctor, they would say, Ian Storch is my doctor. But I think as a family practitioner, I'm a trained internist, like that's the beauty of being the primary care, is that you are the person's doctor. And if, God forbid, they end up in the ER and they say, who's your doctor? They're not going to say, Storch did my colonoscopy. They're going to say, Joel Fetter is my doc. And that's important.
The hospital that I practiced at primarily, I arose through the ranks to be chief of staff. And I made lots of friends who are specialists and referred to them copiously. If I felt I couldn't handle something, they went to the specialist. And I'm really kind of proud of that. I think a lot of folks in family medicine are competent to do what they're trained to do, but when you start getting into areas, especially in the city, you need help. And we practice as a team. I'm the referring person, and my referral source calls me, tells me what's going on, and keeps in touch. And so I think it brings a real continuity of care.
Joel, I'm going to sidestep a little bit. And one of the things that I wanted to talk to you about was the fact that you recently went on a medical mission, which is super cool. We've definitely had some brief discussions about medical missions with other physicians in the past, but I want to hear sort of how you starting at the very beginning. Let's say somebody was listening and they wanted to do a medical mission. How did you come up with the idea? How did you buy the plane tickets? What did you bring with you other than like a toothbrush and some clean underwear, hopefully? And bring us from the beginning, tell us the whole story, and tell us what the experience was like.
Sure. I've known a pediatrician now retired by the name of Stan Grog. Stan practiced in the state of Oklahoma for many, many years as a pediatrician. He and his wife, Barbara, who's a nurse practitioner, started a 501c3 called Power of a Nickel, implying that for a nickel, you really could do a lot more than you thought. And so he started doing mission trips as he started to retire around the world. They've gone to India, to Cuba, to Guatemala, to Nicaragua, Vietnam. They've been in lots of places. And most of the schools have global mission tracks too. I know KCU has a clinic in Guatemala. I haven't done that. But Stan has put a bug in my ear for the last 20 years. Joel, you should go on a medical mission. Why, Stan? I don't have time. I get 2 weeks off a year and I do my Navy 2 weeks with that. I don't have time. My patients won't let me go, and my partners don't want me to go. So what am I to do? So when I finally retired, he said, now you can't give me an excuse. You've got to go. So I let him bother me about 4 or 5 years. And then he called me one night and said, hey, this is something you're going to want to do. And I said, what is that, Stan? He said, we're going to Vietnam. I said, what? I said, that's a long way away, isn't it? And he said, it's a day or so. It was 29 hours. But anyway, I finally decided that I was going to do one, and I'd always wanted to do one. So I signed up. There were 5 physician providers. I was at family medicine. Stan's a pediatrician. We had a pediatric ER fellowship trained young lady that went with us. We had a retired cardiothoracic surgeon we went with, and we had a general internist we went with. So there were 5 of us, plus Stan's wife, Barbara, is a nurse practitioner, plus we had some lay people to help us. I had no idea what I was doing when I planned this trip, but I paid for my ticket, which was quite expensive, and I went. And so the preparation for this trip was very intense. Stan put out a list of things to bring. I mean, toilet paper, medication, and I take some medications myself, but they wanted us to bring samples, which we used when we were there. He shipped a bunch over because he's used to doing this. It was a lot more preparation than I ever dreamed. You have to get not only a passport, you have to get a 30-day visa to go to Vietnam. I never learned the language, but I could make my way around. So anyway, I got on the plane. My plane flew from Kansas City to San Francisco to Tokyo, and then Tokyo to Ho Chi Minh City. Ho Chi Minh City is the old Saigon. I don't know what I was expecting because the only chance I ever had to go over there in the past when I was a young man and I was about to get drafted. And I said to myself, I don't think I'm going to take that trip. So I got into medical school, thank the Lord, and joined the Navy. And I'll tell you more about that when I have a chance. But the plane ride was fine. It was 29 hours if you count the time in the plane and the time waiting at airports to make connections. I got in at 3 in the morning. I got a cab. I spent $100 on Vietnamese money, which is the dong, and there are 24,000 dong to a dollar. So for $100, I was an instant millionaire, and I never had to take money out again. So I went to the hotel that we were staying at. It was a pretty nice hotel, actually. They didn't have my room. They didn't know I was coming. And I said to myself, This is going to be nice. I was sleeping on the couch. So they finally got a hold of my roommates, which was the thoracic surgeon and his girlfriend and the internist. And we shared an apartment. And they were nice apartments. They were air conditioned. The first weekend we toured, we saw Ho Chi Minh City, a great deal of it. We saw the market system there. I bought a suit there for $125. I've yet to wear it, but maybe I will because everybody else buys a suit when they go there. Dr. Grog picked out 4 orphanages. One was Buddhist, which is the majority of the population. One was Lutheran. One was evangelical. And one was Catholic. Each of these orphanages has anywhere from 70 to 150 kids. What we do is these orphanages were outside 2 hours to 3 hours outside of Ho Chi Minh City. So we took a bus every morning, got on the bus and rode. We had our counterparts, the Vietnamese people that were with us. We had a guide that was fantastic and she spoke perfect English. Each of us was assigned a Vietnamese physician that served as our interpreter. I got to be very good friends with a young man, 26 years old, so very young to me, who had just graduated medical school. Now, the government pays for medical school, but when they finish, it's very different than our system. There is no match. They have to do a year and a half of postgraduate medical education. Then they take their tests. The top 20% are allowed to be specialists. Everybody else is in primary care. There is no discussion here. There is no choice here. Well, this kid and I, because he was, have become friends. I never used WhatsApp in my entire life, and we're WhatsApping. And he is going to listen to our ACOFP meeting virtually. He asked me if he could. He met me at the airport to say goodbye to me. I mean, it's just heartwarming. In Ho Chi Minh City, there are 14 million people, and there are 9 million tripod bikes, motorized. I have never seen anything like it in my life. I feared walking across the street, but finally I got the nerve to just keep walking and never stop. They never have a car accident. There is no crime there because there are cameras everywhere. And the police are there in 3 minutes, and the sentence for everyone is life in prison. So it really cuts down the crime. The people are wonderful. They're so friendly. They'll do anything you ask. They'll translate for you when they can. But the most impressive thing, and the thing we went for, is the orphanages. Let me give you an example. The first orphanage we went to was for severely developmentally delayed kids. These kids could not get off the floor. Spastic paraplegia. They were on carts on the floor. The caretakers got on the floor and fed them and bathed them. We got on the floor to examine them. I had one young lady, she was probably 15 or 16. She had brittle bone disease, and she had a feeding tube and an assortment of other tubes, and just examined them, asked the care staff if there were any problems. We took care of those the best we could. I was pretty depressed after that visit, but it was amazing to me the involvement of the caregivers there. They treated the kids wonderfully. Another one of the orphanages we went to were for regular kids. And keep in mind, no American or any other tourist can adopt a Vietnamese kid. It's only for Vietnamese to do. So these kids are in their orphanages for a long time. They are so cute. I could have taken 2 or 3 home with me. They were just so cute. I have a multitude of pictures I wish I could show. Maybe someday I'll send them to you and you can see them, but they're just so cute. And then this one orphanage was a Catholic orphanage, and the headmaster was a Catholic nun by the name of Sister Van. This lady ran the show there. And, the little boys, like little boys are, they're slapping each other and horsing around. And it was cute to watch them. But when she walked in, they just fell in line. And she would teach them during the day. And then we would examine them. They all had runny noses, they had runny eyes, they had colds, constipation, diarrhea. But they were so cute. And I had my interpreter, Dui, was with me, the Vietnamese physician, and he asked them, they wanted us to see on them. And they all asked me how old I was. And so I asked, wait, I said, why are they asking me this? Well, because they think you're old. I said, well, I am. But they're so cute. I have a picture of two of the little girls. They were about 7, one on each of my laps, smiling and holding a peace sign up. And they sang to us, they fed us. And then there were a couple of more orphanages that had relatively normal kids, but some of them were pretty disabled. And these kids stayed there for a long time. They had some infants that twins, one was adopted, and then the pediatric specialist that was with us, that twin wanted to actually go home with her. Obviously, we couldn't do that. The food is very good. We drank our share, but just being around the people was great. And then the second weekend we were there before we were going to leave, they took us on a tour of the Mekong Delta, the river that the GIs from America, the Viet Cong, in that river. And we took that river and we had a guide for that. Then we went to Ho Chi Minh City, saw the French palace that was there. We saw the Ho Chi Minh Trail and the tunnels that they transported troops during the Vietnam War and weapons up to Hanoi. I didn't go in the tunnels, but two of my colleagues did. It's quite fascinating. We got to go on a river cruise. They've got some pretty good development downtown, but they are a third world country who's doing their best to become a second or first world country. They built some very nice downtown. The time we were there, it was the Tet Festival. It's their Lunar New Year. It's a big deal there. All the women dress in native costumes. They have flowers. They have food on the streets everywhere. It was just amazing. It's a culture that you really want to get to know and want to get to see. And I had a chance to do that. We were there 9 days. And I intend to go back next year. It'll be next year in March with the same group of people and meet my Vietnamese physician friend. I got to say, it was inspiring. It was. There wasn't anything I didn't like about it.
I'm in. I don't know if I can go next year, but at some
You
point,
can. You're
yeah.
invited. You could go. And we need a GI doctor, I think, more for the staff than anybody else.
Right. Joe, we're going to shift gears a little bit, and I want to start talking about you. So can you tell us where you grew up and when you decided you wanted to be a doc?
I grew up in New York City. My father was a World War II vet. He met my mother, who was from Kansas City in New York. They married, quickly had me. My father decided, he was actually from upstate New York. He was one of 12 kids. And he moved down to the city and got married. And he wanted to leave. He didn't like the hustle bustle of New York City. So they actually, when I was 2 years old, moved to Kansas City. So I have very little remembrance of New York City, but I had lots of family there. My family always thought there was nothing past the East Coast. They thought I lived on an Indian reservation. It was called Shawnee Mission. I mean, I got teased incessantly by my family there. They're all gone now, but so I was raised in Kansas City. I went to high school here, went to college in Iowa and at the University of Kansas. I applied to my medical school. This was back in 1970, the year of the draft lottery. I didn't get in my first year. A lesson to all who don't get into school their first year. I was able to enter as an enlisted guy, fireman fetter you're looking at. I went to Great Lakes Naval Training Center. I did boot camp. They hung me off the side of a ship for 2 weeks and I chipped paint. I actually liked it a lot, but I knew I wanted to be a doctor. My dad gave me two choices. You will either play for the New York Yankees. I couldn't play baseball, or you will be a doctor. So I decided to do the doctor route.
Joe, when did you find out about osteopathic school? And can you tell us about your application and acceptance at that time?
Sure. This was back in 1970, 71. I'm from a Jewish family. Jews go to specialists. They go to a specialist for their stomach, for their lungs, for this, for that. So I had no idea what a family doctor was. I'm not even sure I knew what a general internist was. I certainly didn't know what a DO was. But one of my dad's friends was a DO. And I went to see him, and he got me a visit with the dean at KCU. And back in those days, it was kind of who you knew that got you in, because I certainly could never get in today. These kids are so bright. But they gave me an opportunity and I got in. I went to school there. I stayed in the Navy. The Navy paid for my last 2 years of school. I did my training in Philadelphia at the Naval Hospital there, which is now a parking lot, and it was excellent training. And then I went out to San Diego for a couple of years of active duty. I served as a family doc in San Diego. I was aboard a ship for 1 year that was actually dry docked. And then I went to Naval Air Station Miramar, which is where they later filmed Top Gun. So it's pretty cool there. And I love San Diego. So many physicians in San Diego. It was so crowded. We decided to come back to Kansas City, where my family was, where the grandparents were. And I started in practice there. I stayed in the Navy Reserve for 38 years. I retired as an '06, a captain, like a colonel in the Army. One thing that I don't think most people know about me, I'm in an organization called Military Officers Association of America, and I'm very active. I was president of my chapter here in Kansas City. I was president of the Council of Kansas, and I've applied for a position on the board. And I'm going to DC right after my New Orleans meeting to see how I do with that. But the military meant a great deal to me. I learned so much. Here I am, a Jewish boy from Kansas. I don't think there was a Jew on my ship, except there was one enlisted guy, and he was incessant of naming every Jewish holiday as a day he should get off work. So the captain made me the Jewish lay leader on the ship and had me evaluate this kid. I said, he can work every day but the high holy days. I do. and so, and I met a rabbi there on the base. He was the base chaplain. And everybody treated me so nice. I mean, the thing I like about the Navy, I liked about Navy medicine that I really don't see in the civilian sector is we worked as a team. I mean, you had a medical department, you had corpsmen, you had lab techs, pharmacy techs, x-ray techs, you had chief administrative people, but you worked as a team. And I learned some valuable lessons. When you lead a group of men and women, you're the last to eat. You're the last to do anything. And you got to remember that, because although I never had to go to war with these folks, I would have trusted them to go to war with. And going to war is not a new thing today in the reserve area. Lots of young DOs, and the military has a slew of young DOs that are in all specialties, well trained. President Biden's physician is a DO by the name of Kevin O'Connor. He's a family medicine guy. I got a chance to talk to him, have dinner with him, and he's all Army. And he and I kid around Navy versus Army. Navy's always better, but he doesn't agree with that. But I just met so many great people and have been able to get some of them to speak at our meetings about military medicine, which has become a big deal. And it was such an important part of my life that I want everybody to know about it, at least use it as an option. A lot of these kids come out of school with $500,000 in debt. The service will cover all your debts while you're in school. It's pretty nice to come out debt free. I did.
One other piece that I want to talk to you about is, so you decided you wanted to set up a family practice. Did you hang a shingle? Did you join another doctor in practice? Did you join a group? And what was your practice like when you decided that it was time for you to find some other things to do? Obviously, you're staying busy, but find some other things.
I was practicing solo at the time when the first Gulf War came, and I happened to be on my 2 weeks for training up in Whidbey Island, Washington, and they were starting to recall troops back in those days. And luckily, I wasn't recalled, and I came back, and my partners wanted to charge me rent for the time I was away. It really got very vicious back in those days. Partners were kicking doctors out of their practices, not just in family medicine, but I knew an orthopedic surgeon that had to go to work in academia because his partners wanted him to pay rent. It got kind of nasty, actually. But anyway, it taught me a good lesson. So I joined a group. There were 3 female physicians and myself, and they let me use my 2 weeks vacation to do my active duty in the Navy. And I got to go to Japan 3 times. I got to go to Spain, got to go to Portugal, got to go to a lot of places in the States, Bethesda, Portsmouth, San Diego. Oakland. Join the Navy, see the world was what they used to say. And, I got a good look at the world and met a lot of people that I'm still in touch with to this very day.
Joel, your story is great. Thank you for sharing everything with us. I have one last grand finale question, which we ask all of our guests, which is, can you give us one piece of advice that you were given from someone else that has been super impactful in your life that you would like to share with our listeners?
I think since I am a DO, an older DO physician when I was younger told me, always be proud you're a DO. Don't be ashamed of that. There's nothing to be ashamed of. Be proud you're a DO. That's so important. In fact, our motto at the AOA is DO proud. And I am. And I talk up DOs every chance I get because a lot of people, 1 in 4 students that go to medical schools are DOs. That's 25%. We are in every specialty. Everywhere you go, you'll find a DO. I don't care where it is. We are licensed to practice in about 150 countries now. It's incredible what DOs have done and where they came from. At one time, discriminated against, had to start their own hospitals to practice medicine. But we persevered, and I think that perseverance is so important. Be proud you're a DO. Don't be mad at MDs. You're the same as, if not better than. Just be proud. I think that's so important. And it's especially important to impart that message to the young DO students that we see, because they come from many different backgrounds, and they need to have that instilled in them before they leave school. That'd be the advice I would give any young doctor.
I think that's the best advice I've heard since we started the podcast. I appreciate it, Joel. And thank you for spending time with us tonight. I appreciate it.
Thank you so much for inviting me.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.